Thanks very much for being here today.
Thanks for having me.
So I want to start with a subject that you were very outspoken about going back to last fall when Obamacare was being implemented, and really through the beginning of this year when you announced your campaign in February. And that's your story about your family's health care plan being canceled. That letter that you've sent around, that you've released now, showing that your wife's health care plan was canceled because of Obamacare. And you say the policy jumped from $650 a month to what, $1,480?
Well, I said that when we were offered the replacement plan, that's what the replacement plan was, to find a similar plan through Rocky Mountain Health Plans.
Was, for the record right here, was that plan, the $650 a month plan, was that the only health insurance coverage under your name or for anybody else in your family at the
Yes,
time?
it was. I mean, that's the plan that we had chosen. We had been with Rocky Mountain Health Plans before we got elected to Congress. We liked the plan. We wanted to keep it. And the primary promises that were made when Obamacare passed, there were three. That if you liked your health care plan, you could keep it. If you liked your doctor, you'd be able to keep your doctor. And that this would lower the price of health care $2,500 by the end of the first year. All three of them have proven to be false, including the fact that over 340,000 Coloradans have had their health insurance plans canceled.
Now, there's no pay stub that would show any enrollment by you in a plan that's available only to members of Congress.
We're in the exchange.
You're in the, okay. But before that, the health care plan's only available to members of Congress. The Rocky Mountain Health Care Plan, the letters in your wife's name, just making sure.
Yeah, no, we were in Rocky Mountain Health Plans, and that's what got canceled.
The $650 plan covered all four of you.
That was right, correct.
Okay. We did ask your office for pay stubs to confirm that, because a lot of folks heard that number, $650 a month for a family of four, thought it was incredibly low. So we did try to verify that, and your office said they denied a request to get that.
Well, again, I think if you ask Rocky Mountain Health Plans what they had available, you could find out what they had. Look, I think here's the challenge. Mark Udall promised that if you liked your health care plan, you could keep your health care plan. He didn't say, if I like the health care plan that you have, then you'll be able to keep it. But that's what it's turned into. So Mark Udall's primary promise that he made about the health care plan simply turned out to be a lie. In fact, it was called the lie of the year.
No, you're right about that. But before we move on, your plan, $650 a month plan with Rocky Mountain Health Care, do you remember the name of the plan and what was covered under the plan?
Look, what was covered was what our family needed. The promise for...
What was that? Did it include maternity?
The promise for us was that we would be able to keep the health care plan that we wanted to keep. That turned out to be the lie of the year. Mark Udall broke his promise.
We've gotten that already. But was maternity coverage included in the plan, $650?
It was. We had a child.
Right.
We had a child with our insurance plan.
So what else was covered? Because it's just a lot of folks. I understand that under the old plans with Rocky Mountain Health Plans, maternity coverage was about $330 a month just for an individual woman.
This is the difference between people who defend the health care bill and people who are opposed to the health care bill. They believe that the promise that was made in the health care bill, that if you liked your plan, you could keep your plan. They didn't say that if you had perfect health insurance, if you had the perfect health insurance plan according to me, if it covered this, this, and this. They said if you liked your health care plan, you could keep your health care plan. We liked our health care plan. It met our family needs. 340,000 Coloradans had their health insurance plans canceled. Maybe some of them liked it, maybe some of them wanted something different. But the fact is, President Obama, Mark Udall, broke their promise when it came to the health care plan.
Just on your plan, you said it met your family's needs.
Yes.
Is there a reason that you haven't released more details about that plan and what it covered?
Because of what you're doing right now. You want to compare apples to oranges. You want to say that this health care plan is better than that health care plan, or under Obamacare it covered this, under this plan it didn't cover that. The fact is, the promise was made. If you liked your health care plan, you could keep your health care plan.
Right. I think just because that's such an astounding number. I don't think too many people have gone from $650 a month to nearly $1,500 a month.
Well,
and so
again, if
we're just looking to corroborate that story.
If you look at what the promises made during the health care bill, they broke the fundamental promise in a 2,700-page bill that Nancy Pelosi said we need to pass the bill to find out what's in the bill. The American people were sold a bill of goods on a bundle of lies.
Any chance you want to promise me right here now that you'll next week send me the information, more details?
Why don't you ask Senator Udall? Why don't you ask Senator Udall why he broke his promise? Why the fundamental promise?
We're just chatting about your family's policy, because you chose to make that a big issue. That you chose to hold up that letter before Secretary Sebelius.
340,000 Coloradans found out that Mark Udall's health care plan promise was a lie.
Okay, let's move on to, well, let's stay on Obamacare. House Republicans, including yourself, have voted how many times? 52, 55 to repeal Obamacare?
We have voted to repeal, to replace ideas that would actually work to lower the health care costs and increase the quality of care.
He kept drilling you on that in that first Club 20 debate, saying, you vote 52 times, that's not moving our country forward, that's just being headstrong and stubborn and banging your head against the wall?
Well, so Mark Udall, when he was running for Congress and when he was running for the Senate in 2008, said that he would oppose a government-sponsored health care solution. One of the first things he does is vote for a government-sponsored health care solution, and then he supports a public option. The fact is, Mark Udall broke his word to the people of Colorado, something that he promised in 2008, something he campaigned on, saying that he would vote against something like Obamacare, yet he turned around and cast a deciding vote on it.
You really think Obamacare is, quote-unquote, a government-sponsored option? Because my understanding is that it really drives most people. I know there's subsidies, I know there's a big expansion of Medicaid.
And don't forget the mandates.
But it drives
and don't forget the fact that the IRS is now in charge of it. Thousands of agents are going to be covered.
That everybody have health care. We know about the individual
and mandates
mandate.
within the policy coverage as well.
But the
be
plan that
determined by
you
the
bought,
healthcare
the plan
system,
that your family bought was
HHS.
bought on the private insurance market.
Right.
As are most of the plans that people have to buy on the exchanges.
With mandates controlled by the government, overseen by the IRS, a public option that he said he supports after he said that he wouldn't support a state-sponsored solution. Look, this is what happens when you vote 99% of the time with Barack Obama, like Mark Udall has done. He's stood shoulder to shoulder with the president on the health care bill, foreign policy, taxes, regulations. You know, the problem is what he says in Colorado is not what he has done in Washington.
If Obamacare were repealed, is part of the Republican plan, does that include a plan to cover people with pre-existing conditions?
Look, I've even introduced my own legislation that would cover people with pre-existing conditions. And so absolutely, we can and we should cover people with pre-existing conditions. That's what my legislation would do. But we can do better than what Obamacare did. We can actually put solutions in place that will lower the cost of health care, increase the quality of care, making sure that we have better utilization of health savings accounts to give people more flexibility to meet their family's needs. Obamacare actually makes it more difficult to use health savings accounts. There are ideas on tort reform that we can pursue that will lower the cost of care. There are other ideas that will work far better than what Obamacare did. There is no doubt that what we had before didn't work. But a 2,700-page strictly partisan bill is not the solution, especially when it was sold on a foundation of lies.
Isn't it just as partisan to try to repeal the whole thing, though? 50 times? 50
There's
some odd
bipartisan support. Actually, we've had bipartisan support. When it comes to our efforts to change Obamacare. Look at the Independent Payment Advisory Board. Look, the Independent Payment Advisory Board is a board of bureaucrats that are paid over $100,000 that have basically a veto power over Congress when it comes to telling people in Medicare what kinds of medical services they're going to be eligible for and what kind of things they are not. Mark Udall actually wanted to extend that board of bureaucrats to everybody throughout the entire system. He wanted to have a board of bureaucrats tell everybody what kind of health care they could or could not have.
Okay. Leave it right there. Okay. You're fired up. I like it. We'll be right back on Colorado Politics from the Source.